we will have your first shifting exam. So the coverage will be from the beginning until medical legal aspects of physical injuries. Okay? So with respect to physical injuries, napaniuntay continuation with respect to gunshot wounds. Kanya ako na lang ning i-cut din nga part para dili kay taas. Okay? Um, okay. So let's continue now. Okay, so we're done with that. Okay, so we will continue with respect to abortion. But this abortion is taken up also when we have our discussion on medical legal aspects of sex crimes. But for the sake of physical injuries, ako na lang din siyang i-discuss diri. Okay? Para dili na ka-heavy sa dito sa buwan. Dapit na nga sa last part. Okay? Okay, so under Article 256 of the Revised Penal Code, intentional abortion. So here we have intentional abortion, unintentional abortion, abortion practiced by the pregnant woman herself, abortion practiced by the parents of the pregnant woman with the consent of the pregnant woman, and then abortion practiced by the physician and midwife. Okay, and okay, so this is really different from the abortion you discussed in your OB. Okay, so this is the legal classification of abortion. Okay, so first of all, abortion is defined as the violent expulsion of the fetus, violent expulsion of the fetus. Okay, so it's either a spontaneous abortion or what's this, criminal abortion. So in a country, abortion, if it is not a spontaneous one or if it is not a medical abortion, okay, not medical, but what's this, abortion which is authorized by law, okay. So otherwise, abortion in our country is a criminal act, okay, so it is a crime. So here, intentional abortion is defined as any person who shall intentionally cause an abortion shall suffer the penalty of reclusion temporal if he shall use any violence upon the person of the pregnant woman. Okay, so a person here uses violence upon the person of a pregnant woman. Okay, so for example, he instituted or delivered a fist blow to the abdomen of the pregnant woman. Okay, and a severe fist blow. Okay, and a penalty of prisión mayor if without using violence shall act without the consent of a woman. And then the penalty of prisión correctional in its medium and maximum periods if the woman shall have consented. So you have here violence, okay, okay, and the second without using violence, but or without the consent of the woman, and the next is the woman have consented. So there is consent coming from the woman. Okay, so the woman here consented to the performance of abortion. Okay. And then we have the definition of unintentional abortion. Penalty of prison correctional and its minimum and medium period shall be imposed upon any person who shall cause abortion but unintentionally. So he has no intention of causing such abortion. And the type of abortion, the intentional abortion, okay, of course, there is knowledge that this woman inflicted with physical injury, okay, is pregnant. So the perpetrator of the crime or the offender knows that this woman is pregnant. Okay. In unintentional abortion, the offender, okay, has no knowledge of that pregnancy of the victim. So he unintentionally, okay, caused abortion. Okay. So for example, two women were quarreling. Okay. The other woman woman number 1, okay, doesn't know that woman number 2 is pregnant. Okay, so she inflicted this physical injury to the pregnant woman without knowing that this woman is pregnant. Okay, and after which the woman number 2 who is pregnant, had this abortion. Okay, so that's the difference between intentional and unintentional. So there is knowledge in the first one, intentional abortion, and in unintentional abortion, there is no knowledge that the victim is pregnant. Okay? Okay, next, abortion practiced by the woman herself or by her parents. Okay, the penalty of Rishon correctional in its medium and maximum period shall be imposed upon a woman who shall practice an abortion upon herself or shall consent to any other person should do so. Okay, should na siya. Okay, so a woman shall commit this offense to conceal her dishonor shall suffer the penalty of Rishon correctional in its minimum and medium periods. Notice here, with respect to this, to the penalty, okay, if the woman, okay, performed this abortion, okay, to conceal her dishonor, okay, so performance of abortion to conceal her dishonor is mitigating, okay, meaning the penalty is reduced. Notice the Rishon correctional in its medium and maximum period, okay, the ordinary abortion performed by the or practiced by the woman, okay, has this higher penalty, Rishon correctional in its medium and maximum periods. But when the woman committed this abortion to conceal her dishonor, notice the penalty. It is Rishon correctional still, but it's in minimum and medium periods, meaning the penalty is reduced. So concealing her dishonor is a mitigating thing with respect to this type of abortion practiced by the woman. Okay? Okay. If this crime be committed by the parents of the pregnant woman or either of them, and they act with the consent of the said woman for the purpose of concealing her dishonor, the offenders shall suffer the penalty of Rishon correctional in its medium and maximum periods. Okay, notice here, okay, the same penalty, okay, is given to the parents, okay, parent or parents of the pregnant woman, okay, causing such abortion to the pregnant woman. Okay, the penalty is the same as when the woman causes such abortion. Okay, even if the purpose here with respect to the parents, the purpose is to conceal the dishonor of a pregnant woman, still the penalty is the same. Rishon correctional in its medium and maximum period. This is not a mitigating one with respect to this. The concealment of dishonor is not mitigating if the abortion is committed by the parent or parents of the pregnant woman. Okay, so take note of that. Even if they acted with the consent of the said woman. Okay. Okay, and then we have here the abortion practiced by the physician or midwife in dispensing of abortives. Okay, so dispensing of abortives may be committed by a pharmacist. Okay, so we have three persons here, the physician, midwife, and the pharmacist. Okay, so the penalties provided in Article 256 shall be imposed in their maximum period, meaning this is the same as when the pregnant woman caused or practiced the abortion. Okay, so in its maximum pag yun, maximum naman to medium to no. So gikuha ang medium, maximum period yun eh. So what happens here? The abortion practiced by the physician, midwife, or dispensing abortives by the pharmacist, okay, the penalty is higher. Okay, higher. Wala naman to'y medium. Diretso man maximum. Prison correctional in its maximum period. So it is higher. The penalty is higher. Okay, why? Okay, so again, so upon any physician or midwife who, taking advantage of their scientific knowledge and skill, shall cause an abortion or assist in causing the same. Any pharmacist who, without a proper prescription from a physician, shall dispense any abortive shall suffer arresto mayor and a fine not exceeding 1,000 pesos. So, with respect to the pharmacist, moron gamay-gamay ra, okay? Arresto mayor man iya ha. Okay? But because of this, kaning phrase, taking advantage of their scientific knowledge and skill, this is what made the abortion here practiced by the physician and midwife to be uh, uh, or having this higher penalty. Only siya, taking advantage of their scientific knowledge and skill. This made the abortion here, the penalty of the abortion aggravating. Okay? Kaya taas naman yung penalty. Maximum period na sa prison correctional. Okay? So by taking advantage of the scientific knowledge and skill, okay, the physician or the midwife will be given, if found out guilty, will be given this higher penalty. Okay? Okay, next we have this infanticide. Okay. So under Article 255 of the Revised Penal Code, infanticide is defined as, okay, so the penalty provided for parricide in Article 246 and for murder in Article 248. What is this penalty? Okay, reclusion perpetua. Okay, shall be imposed upon any person who shall kill any child less than 3 days of age or less than 72 hours. Okay, take note of the time, less than 3 days, not 3 days, huh? But less than 3 days. Okay, so if the crime penalized in this article be committed by the mother of the child for the purpose of concealing her dishonor, she shall suffer the penalty of prisión mayor in its medium and maximum periods, and if said crime be committed for the same purpose by the maternal grandparents or either of them, the penalty shall be reclusion temporal. Okay? So with respect to these other personalities, okay, the penalty is lower or reduced. Okay? So shall be imposed upon any person who shall kill any child less than 3 days of age, meaning the penalty here is reclusion perpetua. Okay, here. Please take note of the number of days. Okay, so if we're okay, under the law, okay, a fetus less than 7 months of age. Okay, remember under the law, a month is or a month is made up of 30 days. Okay, under the law, 30 days. Wala 31 has a law. Okay, so 30 days gina ang 1 month. Okay, so if a fetus is less than 7 months of age, completely delivered, and survived for more than 24 hours is considered born. So if you kill a child 6 months of age, for example, okay, completely delivered, completely delivered, and survived or lived for 36 hours, that child is considered born. So if you kill the child, okay, 36, paningitan 36 hours after the child was delivered, that is still considered as infanticide, even if the child is less than 7 months of age. Okay? So if you kill a child less than 7 months of age, okay, and the child was born, completely delivered and born, okay, and he survived or you killed a child, or the child was killed, okay, 12 hours after being delivered, okay, then the child is not considered born. That's why the crime there is not infanticide, because a child under the law is not considered born. So you cannot kill a child who is not born. Okay? Diba? Naman na sa kuan. So a child considered not alive or not born. So kung imo ng patsyon din ha, 12 hours after delivery. So, naginhawa pa na siya pag-deliver, but you kill the child 12 hours after delivery, then the child is not considered born. Ang period, is 24 hours man. So, kung imo nang dipatay at 12 hours of age, then that is not considered infanticide. Okay? So, what crime is committed, if any? None. So, wala infanticide. It is not abortion, okay? It is not infanticide. It is not murder. Okay, here. If the child is 3 days of age, killed, okay, by the neighbor, what crime is committed? So, the crime committed is murder. So, any killing of a minor is considered murder, except, for example, no, exception din na siya. Wala exception. Basta, ang imo kang tan-aw din ha, is or na exception with respect to that, kaya dili man na infanticide. There is an exception, except, for example, if the child was killed, the 3-day-old child was killed by the mother or father, okay, etc. din ha, na personalities, under the crime of parricide. Okay? So a child killed by the neighbor, okay, 3-day-old child killed by the neighbor is considered murder. Why? Because a child, it cannot put up defense, so that is murder. Okay? A child killed by the father, a 3-day-old child killed by the father, what crime is committed? Is it murder? Is it infanticide? Is it homicide? Or parricide? So the crime there committed is parricide, not infanticide. But if the child is a 2-day-old child killed by the father, okay, what crime is committed? Is it infanticide, murder, homicide, or no crime? The crime there committed is infanticide. Think about infanticide. Do not think of the person, okay, doing such crime, but think of the age of the child. Okay, so less than 3 days of age. But when you think about parricide, think about the personalities here. Okay, so any person who shall kill his father, mother, or child, whether legitimate or illegitimate, or any of his ascendants, descendants, kinsa man yung mga ascendants, of course, the parents, grandparents, okay, descendants, yung anak, okay, yung apo, okay, or his spouse. Remember, in this case, the spouse, okay, there is this valid marriage, okay, dili kay common law husband or common law wife ang dipatay. Okay, there must be a valid marriage. Okay, shall be guilty of parricide and shall be punished by the penalty of reclusion perpetual to death. Okay, so death nowadays wala naman na because the death penalty was repealed. Okay, so here, okay, a child, a 3-day-old child, for example, was killed by the father. What crime is committed? So the crime committed is parricide. A 3-day-old child killed by the neighbor, what crime is committed? The crime committed is murder. A 2-day-old child killed by the father, what crime is committed? The crime is infanticide. Okay? So, mo na din ha. Okay. A 3-day-old child killed by the brother, what crime is committed? Is it infanticide, murder, okay, parricide, or no crime? Okay, so take note of the personalities here. There is no brother or sister. Okay, wala mention ang brother or sister. So, in that case, a 3-day-old child killed by the brother is murder. The crime is murder. Okay, a 2-day-old child killed by the brother, the crime committed is infanticide. Sa mura na inyong tan-awin ha, the age of the child and the persons who committed such crime. Ha? So mao na din ha. Okay. Let's now go to the crime of murder. So any person who not falling within the provisions of Article 246, so 246, this is a crime of parricide. Okay. So shall kill another, shall be guilty of murder, and shall be punished by reclusion perpetua to death if committed with any of the following attendant circumstances. Okay, with treachery, taking advantage of superior strength, with aid of armed men, or employing means to weaken the defense or of means or persons to ensure or afford impunity. Okay, I want you to take note ng ani abadi lang din nga i-memorize ginin ninyo by heart. Okay, in consideration of a price, reward, or promise, so murder gihapon na, bisugo ka na okay, na dibayhan ka og pila, okay, or there is this promise, okay, okay, by means of inundation, fire, poison, explosion, shipwreck, okay, etc. Okay, on occasion of any of the calamities, okay, enumerated in the preceding paragraph, or of an earthquake, eruption of a volcano, etc., during epidemic, okay, or other public calamity, okay, evident premeditation, okay, giplano, daan, with cruelty by deliberate and inhumanly augmenting the suffering of the victim, or outraging or scoffing at a person or corpse, okay. Okay, so those are the circumstances which will make the crime a murder. Okay, so tanawa lang na din ha. Okay, so these things, okay, like for example, with respect to number 1, okay, like for example, treachery, okay, this will make the victim unable to defend himself. Okay, mo na din ha. Mo ni, the main thing here with respect to kaning treachery, taking advantage of superior strength. Okay, unsa man ibo pag-put up of defense kung dako ng tao, okay, ang imong kontra, okay, with the aid of armed men, okay, or employing means to weaken the defense, okay. So these are the attendant circumstances or qualifying circumstances that will qualify this crime to murder, not homicide. Okay, so what's the difference between homicide and murder? So in homicide, there is or there are no attending circumstances. Walay evident premeditation, walay treachery, okay? So muna etc. So wala to silang mga attendant circumstances with respect to homicide. Okay? So any person that falling within the provisions of Article 246 shall kill another without the attendance of any of the circumstances enumerated in the next preceding article shall be deemed guilty of homicide and be punished by reclusion temporal. Okay? Okay, then we have here death or physical injuries inflicted under exceptional circumstances. And one of which is here we have under Article 247, any legally married person who having surprised his spouse in the act of committing sexual intercourse with another person shall kill any of them or both of them in the act. Okay, if they are caught in the act performing that sexual intercourse or immediately thereafter. Okay, so meaning This provision will not apply if you kill your spouse or both of them, the paramour and the spouse are killed, okay? The day after, okay? The day after you saw the two having this sexual intercourse. Okay? So dili na na mo apply kay what the provision says here is immediately thereafter. Okay? Or shall inflict upon them any serious physical injury shall suffer the penalty of distierro. Oh my gosh, kana ra iyahang kuan iyang penalty. Distierro. What is distierro? Okay? It is a sort of an exile. I-exile niya siya. Okay, the court will order the guilty person, okay, the husband, for example, or the wife who killed the spouse, okay, his or her spouse, and or the paramour lang, or both of them, okay, shall be penalized with distierro. So the court will order this guilty spouse to go to this place, which is far away. So, tagaan na siya o kanang, what's this, murag sa una, baka itong si Rizal, giadtog exile sa dapitan. Okay, mo na may tabuan na. And the purpose of which is to prevent retaliation from the relatives of the victims. Okay, so maura na siya ang iyang penalty. He will not be penalized with pay. What says reclusion perpetual, reclusion temporal, pay death bayat na. Okay? Ang nahitabuan na killing, okay, of the person or persons. Okay? So ang iyang penalty is distierro. Okay? Provided that, okay, the spouse is caught in the act, okay, or immediately thereafter ang killing. So if he shall inflict physical injuries upon them or any other kind, he shall be exempt from punishment. Okay. And then here, death caused in a tumultuous affray. So while several persons not composing groups organized for the common purpose of assaulting and attacking each other, reciprocally quarrel and assault each other in a confused and tumultuous manner, and in the course of the affray someone is killed, and it cannot be ascertained who actually killed the deceased, but a person or persons who inflicted serious physical injuries can be identified, such person or person shall be punished by prisión mayor. Okay? So nowadays, dali na siguro ma-identified, no? May mga commotion din na identified na na sila who inflicted such, okay, or who killed the victim, okay? Dali na ma-identify, then they will be punished by prison correctional. So ma-identify na karon siguro through the CCTV. Panalitan, no? Or nakakuha din na through the use of a cell phone, nakitaan, kinsag yun patay ato during this tumultuous affray. Okay, so the person or person shall be punished by prisión mayor. If it cannot be determined who inflicted the serious physical injuries on the deceased, the penalty of prisión correctional in its medium and maximum periods shall be imposed upon all those who shall have used violence upon the victim. Okay? So this is a sort of murag conspiracy. The act of one is the act of all. So tanan din ha i-punish. Okay? Okay. So physical injuries inflicted in a tumultuous affray, to death man eh. Physical injuries, okay, so shall suffer the penalty next lower in degree na that provided for the physical injuries so inflicted. So mas lower ni kay physical injuries naman. Okay, so giving assistance to suicide. So we do not have this provision concerning suicide, okay? But we have this provision concerning giving assistance to suicide. Okay, so any person who shall assist another to commit suicide shall suffer the penalty of prisión mayor. If such person lends his assistance to another to the extent of doing the killing himself, he shall suffer the penalty of reclusion temporal. Okay? However, if the suicide is not consummated, the penalty of arresto mayor and its medium and maximum period shall be imposed. Okay? So giving assistance. So dako na siyang penalty, which is reclusion temporal. Okay? So consummated, namatay yun na siya ang ganahan nga mag-commit of suicide through another person. Okay? So this other person, I don't know, unsa iyang gigamit, okay, to assist their person to die. Okay, ganahan man siya nga mamatay. Okay? But if the suicide is not consummated, nabuhi, okay, then the penalty of arresto mayor in its medium and maximum period shall be imposed. Okay? Okay, so that's it for kaning sa mga with respect to the kanang kaning mga crimes. Okay? So let's now take up the last part na ni sa physical injuries. Napan continuation sa katong gunshot wounds. Okay? Pero dili na na ko i-appeal sa exam. Okay. Okay, so let's now go to the gaping of wound. What is a wound gape? Okay, nga mo gape man na mo oblique. Okay? Okay. So the gaping of wound is due to mechanical stretching or dilation. Okay? So as to example, presence of cannula and tracheostomy, okay, or drain in an incised abscess or retraction during surgery. So mechanical stretching. Or it may be due to loss of tissue, okay, through destruction or avulsion or trimming of edges, okay, or retraction of the edges. So remember, okay, the skin contains elastic and collagen fibers. So mo retract na siya, okay? And how much of the skin surface is involved? It is important, okay, in a mode of treatment and prognosis, okay, that you need to determine here the surface that is involved. Okay, so you have here the rule of nines. Okay, so I want you to take note of the rule of nines, especially in cases of burns. Okay, and then we have here factors responsible for the severity of wounds. Okay, hemorrhage. Okay, so loss of 1/3 to 2/5 of circulating blood results in hypovolemia or hypovolemic shock, which is fatal. So it is incompatible with life. Okay, and also take note of the organs they involved also. The size of injury. Okay, so in burns, for example, okay, affecting 1/3 of the body surface of the third degree type is usually fatal. Okay, so as to organs involved, of course, vital organs, okay, and then the big blood vessels also, and then the presence of shock and presence of foreign body or substance introduced into the body. Okay. Okay, and then absence of medical or surgical intervention. So it may lead to infection. Okay. Fatal effects of wounds, direct effects are due to hemorrhage, mechanical injuries on vital organs, and shock. Indirect effects due to secondary hemorrhage following sepsis, specific infection, scarring effect, and secondary shock. And then complications to trauma or injury, shock, hemorrhage, infection, embolism. Okay, just take note of those things. Okay, as to healing of wounds, so the power of human tissue to regenerate. Okay, so this may come in a form of pending a question. Which of the following, okay, regenerates rapidly? Okay, mo gawas ba yan na siya? Nabito to sa ang sa na previous board exam. Okay, which of the following, okay, decomposes rapidly? Okay, or which of the following is not, okay, mangana-ngana ba? Or, okay, so here we have tissues that regenerates rapidly, like connective tissue, the blood-forming tissue, and also the skin. Okay? Um, Having no power or limited capacity to regenerate, those are the highly specialized glandular epithelium, smooth muscle, and neurons, except with respect to the neurons, the bipolar neurons and the olfactory epithelium, okay, which is able to regenerate. And then small clean cut wound covered with lymph in 36 hours. Okay. Large incised wound, the small edges seen in 8 to 12 hours. Okay. The time of healing depends on the vascularity. So the more vascularized the tissue, okay, the faster the healing. The age of the person also. Okay, ka ng mga buwang-buwang na dugay na mag-heal. And then the degree of rest and the nature of the injury. Okay. So dako ang injury or long injury, of course, the healing there is delayed. Okay? So with contaminated wounds, healing is delayed. Okay? As to medical legal investigation of wounds, so all injuries must be described. Okay, when you describe na as to the location, the size, okay, so the depth, okay, and description of wound must be comprehensive. Okay. Examination must not be influenced by any other information obtained from others in making a report or conclusion. So imo yun na sa imong nakitaan din ha. And then we have here the general investigation of the surroundings, okay, examination of the place of commission of the crime, the clothing, investigation of witnesses, the wounding instrument, okay, photo sketching, accurate description of the crime scene, the examinations of the wounded body, okay, applicable to the living and dead victim, the age of the wound, determination of the weapon used, etc. Applicable only to the living, determine whether injury is dangerous to life or fatal, okay, whether it will produce permanent deformity. Then applicable to the dead, determine whether the wound is ante or post-mortem. Okay? So whether it is mortal or not, whether death is accelerated by disease at the time of infliction of the wound, whether the wound is accidental, homicidal, or suicidal. Okay. Okay. And then examination of the wound. Okay. The character. Okay. Something character or type of the wound. Okay. So is it an incised wound, a lacerated wound, whatever kind, abrasion na ba na siya, or a punctured wound. Okay, and then take note of the location. So asam na siya lapit. Okay, right side, left side, asam na sa abdominal area, sa thoracic area, or area. Okay, and then the depth of the wound. Okay, but here with respect to the depth of the wound, ako lang din kanang kasulti if the wound is found in the buhi pa yung pasyente ba or with the victim is still alive, do not poke inside. Ha? Ayaw na i-poke ng kuan ha. Albi na din sa thoracic area or sa abdominal area. Labi na din ha. Ayaw na lang yun. Okay? Okay, masamot. Basig masamot, hinuon lang talam ang wound. And then condition of the surroundings. Okay, the condition of the surroundings means the surroundings of the wound. Okay, is if the wound is a lacerated wound, is there any contusion or whatever din ha, so may naa din ha sa surroundings. Okay, and the extent, the direction, okay, the number of wounds, and the conditions of the locality. So with respect to the conditions of the locality, this means, kasi nahitabo din na sa crime scene, okay? Is there evidence of struggle? Okay? So if there's evidence of struggle, that wound, okay, is a homicidal incised wound tingali or stab, okay? Stab wound, okay? And determination whether the wounds were ante or post-mortem. So you need to have or to know the factors here, the presence of hemorrhage, okay, the signs of inflammation, signs of repair, retraction of edges of the wound. So these factors point out to ante-mortem wounds, okay, retraction of edges. Of course, present na siya sa ante-mortem, meaning, kung mingon tag ante-mortem, the wound was inflicted before the death of the victim. Post-mortem, the wound was inflicted after the death of the victim. Okay? So the presence of hemorrhage more copious and it is arterial. In ante-mortem, post-mortem wound, there is slight hemorrhage or no, none at all, and it is venous in origin. Marks of spouting the blood, since it is arterial, okay, so you have there present in the ante-mortem wound, none in post-mortem wound. Clotted blood, the ante-mortem wound, soft clot or not clotted in post-mortem wound. Okay, and of course you have here the gaping of edges and deep staining of the edges, okay, inflammation and retardative processes. Okay, and there is this presence of kaning mga ante-mortem, kitaan pa na nimo na blister formation siguro, okay, and then you have kung buhi ang victim, kaya na mga katong mga redness, okay, vital reaction, okay. And then, why is it necessary to determine whether the wound is ante-mortem or post-mortem? Okay, so one of which, ang reason is this impossible crime. Okay, so when a wound was inflicted after the death of the victim, then impossible crime sits in because you cannot inflict, okay, or you cannot kill a person who is already dead. Okay? And you cannot inflict that physical injury kung patay na na siya. Unsaon man nimo kung inflict ng physical, ma-inflicted nga physical injury, but mo lagi na impossible of, inherently impossible of inflicting such. Kay ang imong purpose there is to, okay, to, ganahan lagi ka nga masamad, kintahay na nga person. Okay? You have no intention of killing that person kung physical injury na. But if you have this intention to kill that person who is already dead, so wala sa na, dili na may tabo because you cannot kill a dead person. Okay? So, okay. So we have here determination as to whether the wound is homicidal, suicidal, or accidental. So it is really important ha, unsay mga characteristics of the wound, homicidal wound, suicidal wound, or accidental wound. Okay? Because when you examine the victim, a dead victim, for example, okay, makita din ang mga wounds. What is the purpose there of examining or having to perform that autopsy? Nga mo perform ang ka sa autopsy in order to know the cause of death. Yung mo gana imong aim din ha. And then, with respect to that goal, imong tanan, is it a suicidal one? Namatay din siya because ng suicide? Or namatay din siya because he was killed? Okay? Okay, so is it a homicidal one or suicidal one or accidental lang? Okay? Okay, so as to the nature of the wound inflicted, an abrasion, for example, this is a minor injury. Okay, it can be extensive. Okay, daghan na siyang abrasions. Okay, which is seen in vehicular accidents. So it is accidental due to recklessness. Okay, of the driver, for example. Okay, so abrasion is not common in suicidal and murder, and common in homicide. Okay, contusion. Rare in suicidal except when the act was done by jumping from a height. Okay. And incised wound common in suicide and homicide. Okay. Accidental, frequent, but doesn't cause death. Okay. Common in suicide and homicide ang pining incised wound. Okay. For a while, I'm hoping Okay. So contusion, rare in suicide except when the act was done by jumping from a height, incised wound, common in suicide and homicide. Okay. Accidental wound, okay, if incised accidental, it is frequent but doesn't cause death. Accidental honestly. Okay, and it is solitary. Okay. Other information, you have here signs of struggle, absent in suicide, accident or murder, presence of hair or part of nails of the assailant or victim may be a clue, okay, of the sign of, as a sign of struggle, kaning na kay bakit alin na part of the skin, naa sa nails mo, nang importante sa natanawon ng underneath the kaning sa dinhi sa nails, okay? The number and direction of wounds, multiple in homicide, single in suicide, or in accident, okay? Direction of wound, okay, cutthroat, we have here the transverse, in homicide, oblique in suicide, okay? And the nature and extent of the wound, homicidal and accidental by any instrument, okay, suicidal by a sharp instrument. State of clothing, homicidal, in disorder due to struggle. Okay, so factors to determine the time of survival of the victim after infliction of the injury, degree of healing. Okay, so now by signs of repair. Okay, changes in the body in relation to the time of death. Okay, so we will talk about that later. Naman yung mga changes din ha. Okay, yung rigor mortis, albor mortis, etc. Okay, the age of the blood stain and testimony of the witness. Okay, so which of the injuries sustained by the victim caused death? Okay, so if there was conspiracy, it is not necessary to determine who gave the fatal blow, okay? Because the act of one is the act of all with respect to conspiracy. Nagkuan man sila, they decided to commit such crime, they conspire. So pareha silang intention. Okay, so the act of one is the act of all. Without conspiracy, there is this need to determine who gave the fatal blow. Okay. Multiple injuries sustained. Okay. Testimony of the physician is important to determine which of the injuries is fatal. So here comes now ang imong report din ha. Okay. Asa man ni kung naidaghang injuries din na which caused the injury. So mayroon ka, Your Honor, okay, during the kanang trial kinta, Your Honor, mayroon ka the one in the neck, for example, or in the thoracic area or in the abdominal area hitting the liver, for example. Okay? So mo na imuhang testimony. So which of the one was inflicted first? It is necessary for the qualification of the offense committed. Okay? Is the wound at the back? Okay? Mo na gi-inflict first and then ang kuan na ni mga minor lang ng uban. Okay? So that is to qualify the crime to murder. Okay? Factors to consider: the relative position of the assailant and the victim when the first injury was inflicted. Was the assailant at the back of the victim or were they facing each other? Okay? Trajectory of the wound inside the body of the victim. So unsa may nangaigo dito sa internal organs kintahay. Organs involved in the degree of injury, presence of defense wounds on the victim, so there is struggle, okay? So it may be a case of homicide, okay? And testimony of the witness or witnesses. Effect of medical and surgical intervention on the death of the victim. The offender is held liable. Even with surgical intervention, death is a normal and direct consequence of the injury. So this is the proximate cause, okay? So the injury inflicted, okay, is a proximate cause of the death of the victim. So the offender is liable. Okay? The physician may be held liable if the physician is grossly negligent or incompetent in managing the wound. Okay? And the offender may be liable only for physical injuries. So in this case, namatay, okay, ang pasyente because of negligence or incompetence on the part of the physician. Okay? The effect of negligence of the injured person, okay, the offender can be held liable even if injured person was negligent in the proper care and treatment of simple injury. So here comes now the contributory negligence, okay? So when we speak about contributory negligence, okay, here the injured person contributed to further the injury. Okay, adding insult to injury. So there is contributory negligence, and this will, kung mingon ta contributory negligence, this will mitigate the penalty imposed on the offender. Kaning contribute man ang victim. Okay. And then extrinsic evidences and wounds, okay, the possession of a wounding weapon, blood in a weapon, hair and other substances in the weapon, evidences in the clothing, the gunshot, the presence of gunpowder in the hole of entrance. Okay, so we have there a test known as Walker's test in order to determine the presence of gunpowder residues in the clothing of the victim. Okay. And then evidences derived from examination of assailant, okay, clothing of assailant with blood from victim, okay, so tanaw na din ha sa DNA test na kinsa man ang blood din ha, ang nakitaan, okay, na-recover din ha. Okay, the fingernails, you need to determine the substances, okay, substances from the victim. Paraffin test, so we will talk about that when we go to gunshot wounds. Okay, the degree of intoxication, the mental condition, the physical power of the offender or the assailant. Okay, then talking about physical injuries in different parts of the body. Okay, so we have here in the head and neck. Okay, head and neck. The absence of an external wound on the head is not itself permit a conclusion that there is no internal damage. So there may be internal hemorrhage. Okay? The intensity of force is proportional to the degree of damage it will produce. Well, the greater the force, the greater the damage. If the head is mobile, unsupported, and free, the principal effect on the brain is due to shearing movement imparted to it, and if the head is fixed and supported, jarring movement is absent, but fracture is extensive. Okay? So the patient should be under careful, intelligent, and continuous observation for at least 12 to 24 hours to avoid risk to the life of the patient. Kaya kani sometimes kana na hematoma. Okay? So subdural hematoma, for example, epidural hematoma. Okay, dili na manifest diretso. So the patient may look good. Okay? But close monitoring should be done. So kami ana sa una kung assign mi sa neuro ward, okay, Q15, Q5, Q15 ang vital signs. Okay? So every 15 minutes, balik-balik kas pasyente, usahay na ka mag-apong kas pasyente because anytime the patient will just kung ano na siya. The patient will have kanang manifestations and then fatal man na siya. Okay? So muna, tan-on yun na gitsyo or kanang close monitoring yun na ang haton na. Okay, so you have here epidural hematoma due to laceration of the middle meningeal artery by a fracture of the squamous portion of the temporal bone or fracture of the sphenoid. Okay, so dinhi sa temporal area. Okay, so temporal or sa sphenoid, kaya duol ra man na sila. So what is injured there? Unsay na igok, the sever na artery, middle meningeal artery. Okay, so or it may be due to dural sinus there. Okay, so there is loss of consciousness followed by lucid interval, progressive obtundation, ipsilateral pupillary dilation, and contralateral hemiparesis. Okay? So kanang mga epidural hematoma. And then the patient, a victim may have subdural hematoma or hemorrhagic contusion, okay? Or diffuse axonal injuries, sa head, okay? And then skull fractures, you have there the raccoon eyes, okay? Raccoon eyes, which is diagnostic of fractures of the floor of the anterior skull fossa, of the skull. Okay? So raccoon eyes, kay orbital part man na siya, di ba na orbital plate of the frontal bone din ha, so mo na. raccoon eyes. Raccoon eyes, unsa man na makita nimo surrounding the eyes na hematoma surrounding the eyes. Okay, battle sign. Okay, indicative of basilar fracture. Here, there is presence of retroauricular hematoma, CSF alteria, or CSF ragnoria. Okay, so battle sign. Then there can be subarachnoid hemorrhage, which is characterized by sudden onset of the worst headache of life, with nuchal rigidity, photophobia, and loss of consciousness. Okay? And then, na yung mga intracerebral hemorrhage, carotid dissection, vertebral dissection. Okay? So you have here classification of head injuries as to the site of application of force. Okay, na naman taani, crew injury, indirect injuries like katong mga opposite the site of application of force. Okay, country co injuries. Okay, the name mga country co remote injuries, locus minoris resistentia, and the wound, with respect to the wound of the skull, okay, the most common injury is laceration. Okay, so fractures of the skull, fracture allosignature, kanin gawas ba yan niya? Fracture allosignature, a localized depressed fracture showing the nature of the instrument used. Okay, and then in gunshot wound, okay, near shot gunshot wound, the skull there, the fracture, is known as spiderweb comminution. Okay. Because on the wound on the face heals faster because of its vascularity, but serious because they produce ugly scars or other deformities. Okay, kung may deformity on the face, that is considered as serious physical injury. Okay, may present a threat to life because of its proximity to the brain. Okay, kay ba namang mo anang dangerous triangles sa face, no? Okay. And then in the eye, you have subconjunctival hemorrhage due to the fist blow, for example, or fracture of the nasal bone due to the fist blow gyapon. Okay, ear, rupture of tympanic membrane, fist blow on the ear. Okay, daghan isa kaning sa boxing injuries. Okay, and then we have here, okay, daghan na pamanisiyan. Okay, here. Wala ni din here. Wala ni nabibutang, but I saw this or I read this one. Wala na din here. This one in the book of Olarte. Okay, can we read mo sa book of Olarte? If you want to have it copied na ako books ni Olarte. Okay. Pero daghan laging ang kuan sa mga cases mga daghan taas labang ginawag kaayo test. Okay. So kaniwani na kung incorporate some of the things there in the book of Olarte akong gi-incorporate. But kani wala ni na po butang din ha. Okay. Take note of this Shiwara. SCSCIWORA. Shiwara. Okay. So it means spinal cord injury without radiographic abnormality. Okay, basin gawas ni. Spinal cord injury without radiographic abnormality. Okay, so we have here signs and symptoms of myelopathy as a result of trauma in the patient where there is no radiographic abnormality. So makita niyo din na sa x-ray, for example, wala abnormality. Okay? But ang pasyente has this myelopathy. Okay? So it results from non-disruption, okay, or non-disruptive and self-reducing intersegmental deformation of the spinal column with injury to the spinal cord. Okay, so this is more frequent in children and young adults. Okay, Shigura. Okay, then we have injuries to the chest. Okay, most often kaning mga open pneumothorax, okay, which can cause sucking chest wound. Okay, so na naman sa surgery na. Injuries to the lungs, Okay, so you can have also massive hemothorax. So loss of 1.5 liters of blood into the chest cavity results into compression and collapse of the ipsilateral lung and also hypoxia. Okay, so this can be due to penetrating thoracic injury or the blunt trauma. Then you have this flail chest, okay, usually secondary to multiple rib fractures. Okay, cardiac tamponade, okay, and then take note of this, okay. Thoracic aortic tear or rupture is the most common cause of sudden death after a vehicular accident. So, nanggawas ni sa board exam. Okay? Traumatic aortic tear or rupture is the most common cause of sudden death after a vehicular accident. And the tear here usually occurs just beyond the takeoff of the left subclavian artery. Okay, and then you have myocardial contusion and subcutaneous emphysema. Okay, rib fractures. Okay, abdominal injuries. You have here penetrating injuries like due to gunshot or stab wounds. Okay, so the major cause of death is hemorrhage. Okay, okay. So when you are at with respect to stab wound to the omen, okay, the most common organ that is injured, okay, a hollow organ that is injured, of course, the intestines. Kahit daghan guna, dako guna, kanang taas guna siya. Imagine the what says the length of the small intestines lang. It is 7 to 10 meters long. So na siya tuyok na din nasa tubutan ang small intestines. So that is the most common, okay, organ that is injured, okay, in the abdominal hollow organ. But when you are asked the most common visceral organ, ang inyong itubang is the liver, the visceral organ, okay, the solid organ, okay. And that is due to the size of the liver. Okay, and also it can cause severe hemorrhage. The common cause of death is hemorrhage with respect to the liver, so with the spleen. Okay, so it may come in a problem. Okay, so I want you to take note of the organs din na sa quadrants bitaw, so different quadrants of abdomen. Picture it out, okay? Kung unsay naa dinha, okay? Nasa left, nasa right, upper left, upper right, lower left, lower right. Okay, mo na tan-aw ninyo dinha, pag-memorize gyud na siya. Kay ay understandable man sa duwa man guna sila sa medicine yung kuan kani sa lain nga school, but lagi mo na akong sa examination akong gibutang dito kung asa na siya nga quadrants abdomen. So ang spleen naabot dito sa right iliac, right lower iliac ang spleen. So maski ana ba? So please kamo medical students naman mo, so it is expected na kibaw gid mo ana na, ha? Okay. So that's it for the paano kung ganila ending. Okay, with respect to hip fractures, okay, this is common in elderly caused by minor falls, okay? So hip fracture is the most common cause of traumatic death after the age of 75, okay? Okay, so umaw naman siguro na siya. Okay, so okay, so, okay na mo. Okay, so this is included. So the lecture today is included in the exam, okay? Next week. Okay, Ramo. Okay. So the exam, of course, face-to-face ta. It will be at 4:30? 4:30 or Yung sa inyong gusto.
Pwede na 4:30 daw.
Pwede ra 4:30 or sa lunchtime. Di sad, no? So 4:30 na lang para
Yes,
makatuon pa mo.
4:30.
Okay, so 4:30. Okay? So from the beginning until today's lecture. Okay? So do you have any question?
And so far,
Wala.
Doc.
Okay,
None,
so
Doc.
attendance. We read attendance.
Done na, Doc.
Nana, okay, very good. Okay? Sige, thank you everyone and God bless.
Thank you, Doc. God bless, Doc.